Hello, everybody. Thank you for joining this webinar session. My name is Anis. I'm working at the University of Gajah Mada in graduate program of public health. In this webinar, Aihin asked me to share our experience to implement openIMIS in our MPH program. So this is the project that has been supported by Aihin and also the openIMIS international communities, in which we had opportunities to learn openIMIS, and then we introduced openIMIS to our students. So our team in Gajah Mada consists of staff and researchers at the Department of Health Policy Management, including Dr. Giovanni, Dr. Firdous Hafiz, Dr. Gadian, Anissa, and me. So I would like to introduce these experiences, and hopefully we could discuss later on about the experience that we had faced in Gajah Mada University. So my presentation will consist of the introduction of MPH program in University of Gajah Mada, oldest university in Indonesia, located in Yogyakarta, in Java Island, especially in the in Central Java area in Yogyakarta. So in our webinar, we would like also to introduce the majorings in MPH program that involved in the implementation of openIMIS, which is health financing and insurance majoring and health information system majoring. And then we also introduce shortly about openIMIS features, and then steps to implement openIMIS. So during the implementation, we also conduct evaluation, in which we also request our students to share their experience and expectations toward the two-year MPH program, currently with different majorings or concentrations, from hospital management until health management information system. So there are 10 majorings or concentrations. So every year, about 200 until 300 students admitted totally, and they are distributed in different majorings. But for these years, due to COVID-19, probably the number will be reduced substantially. So with our university, there are several contexts that I think I need to share universal health coverage at the end of 2019. However, until now, our program we have not yet reached the coverage of all population. So far, the statistic from the health insurance agency recorded that 85% of the population, so about 225 million right now, already registered at the health insurance agency out of 260 million population. These kind of situations are also among important learning resources and competencies for MPH students, in which they should also understand the health insurance ecosystem in the country. So far, our students learn about UHC through lecture, case studies, seminars, study visits either to health facilities or health insurance agency, and also we have a limited share on practical implementation due to the situation that limited opportunities for students to learn directly from health facilities or health insurance agency. And also there are several courses. So we are expected that if students could have information systems at campus, so it could bring them more opportunities to learn. And then when they go to the field visit, they could directly for a discussion or critically analyze the situation or the gaps between the theories and implementation. So this is the opportunities for implementing openIMIS in Indonesia. And we before implementing openIMIS, we discussed between the team about the curriculum should include also several materials, including understanding the health system and health insurance context in Indonesia, practical use on openIMIS functions and features, and then a tutorial by facilitators to help them or guide them on understanding openIMIS, and then training by examples, some assignments, and feedbacks. So after a discussion with lecturers, we agree that there were two concentration or majorings that are most suitable for these courses. So health financing and insurance, and health management information system. Finally, during the implementation, another majorings, health policy, was also introduced as part of the introduction of openIMIS in our school. So in health financing and health insurance majoring, there are several courses, but the most important courses that are related to openIMIS were health insurance, managed care, and provider payment mechanisms. In health management information system, there are many courses as well, but the student could also learn about openIMIS and then embed these functionalities and learning objective, especially through the tutorials and also from the uh, uh, the course of information system design and development due to their opportunities to critically analyze the existing features and function of openIMIS software due to the uh, uh, open source features of openIMIS. So when we decided to introduce openIMIS, we discussed several potentials of openIMIS introduction to our curriculum. First, it is expected that students will get the hands-on experiences on HMIS application to support several business process in health insurance and also health facilities. And then to discuss opportunities and challenges of digital system implementation for health insurance in low resource setting. So in this kind of course, we also invited our colleague uh, from Germany to introduce the global public health situation on health insurance. And then students are expected to critically analyze and compare what are the features in openIMIS compared to the situation in Indonesia. And then students also expected to understand the managed care workflows in Indonesia. And especially for students in HMIS are expected to develop, to discuss about standard and interoperability, especially for referral system, reporting, claim, and reimbursement. So this is some features of openIMIS that I would not like to discuss more detail. It is a web-based system. There are several functions from policies of for managing the injuries, claim management, administration from the health facilities perspective, and also several tools to manage the data. These are some functionalities. For example, for health insurance agency to manage several features in managing the insurance products or health insurance claim. Features for health facilities, managing the benefit package, several features to manage drugs that are available for injuries, and also some medical services prices that are available, etc. So there are several features of openIMIS that we introduce to the students during the course. And finally, to implement this openIMIS, we decided to have several steps for implementation. First, we identify the learning objectives of the courses in our majoring program, and then develop specific learning and instructional courses. We develop as well some scenarios, learning and assignment, and then we collect through evaluation student experiences on using openIMIS, and then we gather the feedback from users, and hopefully we would like also to disseminate this result to IHIN communities and also our BPJS Kesehatan or health insurance agencies in Indonesia. So we are very happy to be invited by IHIN to share these experiences as part of the dissemination of our experiences to colleagues, to international communities. So to implement this program, we introduced openIMIS from April until November last year. So the planning and preparation were started on April in 1.5 months. And then we developed several modules in our e-learning ecosystems. And then we implement the modules and also some tutorials, some courses, and then ended by evaluation. So this is the screenshot of our e-learning. This is the e-learning of openIMIS introduction. Our e-learning system in Gadjah Mada University using open source Moodle system. And in this course, we describe the course, and then we develop the learning objectives. And here below, we also develop several videos and tutorial. And we also here recorded some videos, including I think Professor Jan also hopefully attended as well this this course, this webinar. We recorded as well uh, the tutorials, either also from our colleague in Gadjah Mada universities. And all the modules for introducing openIMIS include videos. There were 7 videos, pre-tests, some tutorials, case discussion, and final assignment. So this project were joined by 25 students during the process. And then from the evaluations, from 25 students, 76% say that syllabus of e-learning was clear and well described and and it is helpful for students to joining the course. And 2/3 of the students also say that online materials were helpful. Yeah, many of the students agree and about the module, especially helpful to prepare for the final assignment. In terms of the facilitators, students also positively appraise the role of facilitators to learn about openIMIS. However, still some students felt that so-so about the role of the facilitators. And with regard to the expectation of the students, yes, 50-50 from the students would like to learn more about openIMIS, and another said neutral. So it means that probably students who whose background are not on health insurance or probably with other issues related to the user interface. They said neutral about understanding more about openIMIS. So in terms of the self-evaluations, majority of the students say that they contribute actively during the learning process, and majority as well say that learning objectives were accomplished by students. So yeah, from this exercise, we felt that the MPH student in Gajah Mada University shown positive response to openIMIS introductions, and it is mostly supported by the availability of learning materials. However, several issues should be handled, uh, especially with related to the language of openIMIS, which is still in English. User interface, many still are not familiar with the user interface of openIMIS, and also the differences of business process between openIMIS and also the health insurance management system in Indonesia. So it is also something to be explored, even though we introduced that there are many models of health insurance in the world. I think this kind of introduction of openIMIS should be supported as well with completed materials and introducing the health system context on implementing openIMIS, especially because of openIMIS was developed and implemented very well in Nepal. So I think for the future plan, it is interesting if we could also invite our colleague from Nepal to introduce openIMIS in Nepal situation, and then introduce them to our students in Indonesia. Other future plan that has been considered by the team in Indonesia, it's also to adopt openIMIS into Bahasa Indonesia or our national language, so that user interface will be more familiar, and then student hopefully could have more opportunities to explore more detail about openIMIS. And also other future plan include as well to compare what are the features and functionalities of openIMIS in what has been available in the future right now compared to the situation in Indonesia. So this is some recommendation and also some experiences that we had so far during the openIMIS introduction into our MPH program. And in this time, I'm also accompanied by our colleague Dr. Guardian and also Anissa, if they also have some additional or important information. It is please to add some or other usable information to our participants of this webinar. So thank you very much. So if Gugu or Nisa would like to add some or other information, feel free. Thank you very much for your attendance.
Thank you, Pak Anis, Dr. Guardian, and Miss Anissa. If you have something you would like to say, you can unmute your mic.
Hi, everyone. My name is Gugu. I'm from the Gajah Mada University, Anis colleague. We are implementing the openIMIS practicums in our master programs last years. And there are some lessons learned about the openIMIS introductions to our MPH programs. So I just want to add that the openIMIS is very potential, not only for the postgraduate programs of public health, but also it can be also undertaken by the undergraduate programs, either in public health, medicine, nursing, health information management, or even computer science, if it is open and can be used to develop some modules that related to the innovations that can be implemented in Indonesian context. For example, like Anis mentioned about interoperability with multi existing systems that have been running in health related organizations. And also the openIMIS training program can also attended by the practitioners in district health office, for example, insurance company, social security for health or BPJS Kesehatan in Indonesia, and even the Ministry of Health, because even though that Indonesia, like BPJS Kesehatan, already use their own system, but the flow of the mechanisms from registrations, memberships, and claims, and the process of the flow of the process is almost similar. So it is very useful when they want to accommodate the claims, memberships, and etc. And even the individuals can also learns about openIMIS, researchers, for example, or individuals who have interest in health insurance management systems. So I guess in the next futures, it is very possible to make the openIMIS educational or training programs to be available not only for the postgraduate program, but also for others. In undergraduate or practitioners or individual who have interest in health insurance. I think that's one of the lesson learned that we have. Thank you.
Yes, thank you, Dr. Garjan. We would also like to acknowledge the attendance of Sir Siddharth Srivastava from the openIMIS initiative. And we also have Professor Jens. Professor, you can unmute your mic if you want to ask this question.
Hello, everybody. Hello, friends in Indonesia, and hello, Anis.
Yes, bro. Hello.
I think your very, very last point on the last slide is very valuable. The idea of linking the features of openIMIS with the information systems which are used in your insurance system to make it more practically relevant, because openIMIS, as you already mentioned, is in a way a generic system which is supposed to be applied to the business processes of the different countries. So having a look at where does BPJS actually stand in terms of IT? Do they have systems which perform some of these functions, or some in some areas maybe more or maybe less? I think that would make it more relevant, especially because I believe you also have students which actually work for the health insurance.
Yes.
So my question was, do you already have concrete plans for making such a comparison between openIMIS and the health insurance information system in Indonesia?
Thank you, Prof. Jens. It is a very important question. So actually, this question has been raised during our final evaluation from the student between facilitators and the students. First, students also still have a limited knowledge of different model of health insurance system in the world. For example, Indonesia, we have prospective payment using INASI-BJIS, which is sometimes also very different with claim management system in the openIMIS. So what we thought is we need to describe module by module, and then see, for example, from for claim management, what are the business process in openIMIS, and we will describe as well what are the existing situation in health insurance context. And then for example, injury registration, what are available in openIMIS and what are the situation existing in reality in Indonesia. So based on comparison one by one, hopefully we could have some metrics, and then like what you suggest, we can see that probably openIMIS, some functionalities have, for example, highly similarity with Indonesian context. So in this kind of situation, probably this module or these features could be used as generic modules that will be very important for students to learn in campus, and they have more opportunities to learn, to learn and also say that this is the real the similar function with existing information system in the field. But for other functions that are very low similarities, we thought that probably BPJS Kesehatan system could also be contribute to openIMIS. So this is another model of health insurance that are available in countries in low resource setting, and hopefully we could have these additional new modules in openIMIS that probably could be implemented in other countries that have similarities with Indonesian health insurance system. So we have not yet concrete plan, but this is what we thought for the next program. We are expected to invite students to conduct this kind of analysis and then writing a research proposal to compare this health insurance modules in openIMIS and Indonesian setting. Thank you, Prof. Jens.
Thank you, Pak Anis. We also have a question from Sir Siddharth.
Thank you, Shah, and thank you, Anis. It's a very interesting presentation, and what you say. I'm also working with the Global Initiative, and for example, in Tanzania, we are also trying to create with universities short programs, maybe with a slightly different focus, because there it's about certifying certain staff. So that institution is already doing this kind of certifications for the private sector, and now we are trying for a public health insurance scheme that if they come up with a smaller course and try to apply. But your use case, as you mentioned, is very interesting, and I think you partly already answered my question, and it's in direction of what you were saying. I think, as you mentioned, it would be very interesting to really come from the perspective of, as you said, the different insurance models, because that I would imagine also as a public health course is relevant for you to talk to students about what are the different kinds of models. So for example, in formal sector, you have the formal sector, how do schemes actually function there? What kind of provider payment mechanisms are there? These are all important things to teach. And I think there also the tool could then be used quite well to make these comparisons, to show capitation payments, how do they happen, how are they calculated? These are things you can show from the tool, and I think it would be a good way to bring this together, to talk about insurance models and then relate it to openIMIS, which is a software, and there are other softwares in different contexts. And also we had done some trainings recently on the initiative side, and there we try to also start off with this kind of a generic approach to first try and talk about what are the different ways in which insurance schemes functions, what are the different business processes, and maybe that could also help contribute a little bit to what you will develop in the module. Thank you.
Thank you, Siddharth. Actually this question raised me other ideas. Why don't we try Indonesia, Tanzania, and Nepal, for example, and then we have the matrix. So consist of these three countries, and then we develop some what are the similarities, what are the differences, and what are available in openIMIS. So hopefully, what are the situation in Tanzania could also contribute to openIMIS, in which several modules are not available, for example. But for other business processes that are similar, so we could also recommend that this openIMIS could be implemented in countries that have some similarities on this kind or several aspects on business process, on provider payment, on registration, or others. So I think yeah, if we could continue, I think we could also contribute to openIMIS in terms of developing the high-level business process that finally could be adopted by other teams right now. Other teams right now are going to develop more openIMIS function that could be with the generic function could be implemented in other situation, especially from the perspective of data exchange and its IE, health information exchange. But from the business process perspective, especially on health insurance, because there are several models that are different. I think if we could continue to collaborate on this, I think that will be interesting. Probably Gugu or Nisa could also have other comment. Feel free.
Yes, thank you, Pak Anis. We also have another question. What are the learning objectives of the openIMIS e-learning course?
So in our e-learning courses, the learning objective is first to introduce students with hands-on experiences on HMI's application to support several business process in health insurance management, either in health facilities and insurance agencies. And then this e-learning also among the objective are to discuss the opportunities and challenges of digital system implementation in health insurance in low resource settings. And then through this e-learning, students are expected to critically analyze and compare with local context. And then students are also expected to understand the managed care workflow in Indonesian settings. And especially for HMI students are expected to discuss about opportunities for standard and interoperability for several business process in health insurance management. Thank you, Cha.
All right, thank you, Pak Anis. I think that is the last question from our participants. Or if there's anyone else who would like to still ask a question, still have time.
This is again Jens from Germany. May I ask a question or make a comment?
Yes, Professor.
Anis, I want to take up your idea and from the colleague in Tanzania about taking openIMIS in a way also as a tool to illustrate different health financing schemes or different health financing approaches. And I just want to add to that, I think it makes a lot of sense. Keep in mind that it's not only the students at the universities who have to learn about these systems, but also many, many different decision makers. And what we see in Germany is that the people who make the decisions, and it's not necessarily the Minister of Health, but maybe it is something somebody in a district or a province, or even somebody in the management of a health insurance system. They don't understand the relation between IT and health financing. So what you described, this idea of taking openIMIS in a way as an illustration, as making sort of the IT for health insurance tangible, so people can see it. I think that would be very valuable, not only in the more narrow range of teaching, but also in terms of dissemination, outreach, because in a way the need for information is very, very similar. So I just want to support this idea. I think it makes a lot of sense to expand on that and use openIMIS to show what health insurance actually need in terms of IT.
Yeah, agree, Prof. Jen. So I think this is a very useful comments, a very beneficial comments for us. So, for example, in the current situation of COVID-19, for example, Indonesian Health Insurance Agency just released 2 features, which are very different from the former features. The first one is telemedicine consultation, and then the second one is several features for online screening. So these features are available in mobile apps for Indonesian health insurance members. Right now, these mobile apps have been downloaded 9 million after the pandemic. Before the pandemic, it have only downloaded by 5 million of users. So understanding the IT features and functionalities are very important for health insurance stakeholders, either in the agency or also in the district health office, provincial health office, and also health facilities level as well. So I am agree with you that to discuss this kind of opportunities are should not be limited to the students only in the university, but also to our colleague that directly providing the role and services to the community in day-to-day basis. So obtaining information from them in the field is very important to improve the functionalities of several IT solutions for health insurance management. Thank you, Prof. Jens.
Yes, thank you, Professor Jens and Pak Anis. I think there are no more questions from our participants, so we can wrap up the session. So again, thank you so much, Pak Anis, Dr. Garjan, and Miss Anissa for making time for the AN community, and to also to our participants for actively participating in this session, especially the inputs of Professor Jens and Sir Siddharth. Maybe for the last message, Pak Anis.
Yes, I think for the closing statement, thank you very much for IHIN for offering the opportunities for Gadjah Mada University to implement openIMIS for our students, and also thank you very much for all the participants who attend this session for useful comments and also questions. We in Indonesia are very very happy to collaborate on this kind of topics to improve health insurance management with usable and meaningful information technologies.
Thank you so much,
you.
Pak Anis.
Yes.
Thank you, everyone. Keep safe.